How to survive a heart attack when no one is around to help. Have you ever thought about what you'd do if a heart attack struck and no one was around to help? For many, that situation sounds terrifying. But the truth is, your actions in those first few minutes can make all the difference. In this video, we'll dive into how to recognize the symptoms early, take immediate life-saving steps, and prepare for emergencies before they happen. By the end, you'll not only feel more informed, but also more empowered to act decisively during a life-threatening situation. A heart attack occurs when the blood flow to a part of the heart is blocked. This blockage is often caused by a buildup of cholesterol, fat, or other substances in the coronary arteries. When blood and the oxygen it carries can't reach the heart muscle, the affected area begins to die. This is why every second matters during a heart attack. It's not just something that happens to older people. Anyone, regardless of age, can be at risk. Recognizing the warning signs early is key to survival, and that's exactly where we'll begin. The symptoms of a heart attack aren't always dramatic, like we see in movies. It can start slowly, with mild discomfort that builds over time. Here's what to look out for. Chest pain or pressure, often described as a squeezing, fullness, or heaviness in the chest. Shortness of breath. You may find it hard to breathe, even at rest. Nausea, cold sweats, or lightheadedness. These symptoms can sometimes be mistaken for other conditions. There are also symptoms that can feel less obvious. Pain or discomfort in the arms, neck, shoulder, jaw, or back. A feeling similar to heartburn or indigestion. Extreme fatigue or exhaustion that doesn't seem normal. Knowing these signs can help you act quickly, but could this also be anxiety or indigestion? If in doubt, always treat the situation as a potential heart attack and take immediate action. Now let's talk about what steps you need to take if you experience a heart attack while alone. These actions could save your life. As soon as you notice chest pain, shortness of breath, or any combination of the symptoms we discussed earlier, pay close attention. Time is critical, and the earlier you act, the better. Even if you are unsure, do not delay. Dial 911 or your local emergency number. Stay on the line with the dispatcher, describe your symptoms, and follow their instructions. Keep your phone nearby in case you lose mobility. It's natural to panic during a heart attack, but staying calm is essential. Anxiety and overexertion will only put more strain on your heart. Breathe slowly and remind yourself that help is on the way. If you feel faint or weak, sit down or lie in a position that helps blood circulate more easily. A seated position with your back supported and knees slightly bent is ideal. Avoid lying flat, as this can make breathing more difficult. Do not try to walk it off or engage in any physical activities like climbing stairs. Sudden exertion can further strain your heart. If you can, unlock your door to make it easier for emergency responders to reach you. Small actions like leaving a door unlocked or turning on lights can save precious seconds for paramedics. You may have heard about methods like cough CPR, which suggests you can stave off a heart attack by coughing forcefully. This technique has no scientific backing and may even cause harm. Focus on the evidence-based steps we've outlined here. Preparation can drastically improve outcomes in emergencies. Let's look at ways you can be ready. Save emergency contacts, including 911 and close family members, on speed dial in your phone. This saves time and ensures quick action when it matters most. Automated external defibrillators, AEDs, are life-saving devices that can restart your heart in the case of cardiac arrest. Familiarize yourself with AED locations in your area, particularly in workplaces, gyms, or public spaces. Always keep your phone within arm's reach, particularly if you live alone or have heart-related risk factors. Wear a medical ID bracelet or carry a card listing your medical conditions, allergies, and any medications you're taking. Emergency responders can use this information to tailor their care. Regular health checkups can help you stay on top of risk factors like high blood pressure, high cholesterol, or diabetes. Addressing these risks proactively reduces your chance of having a heart attack in the first place. There's a lot of misinformation when it comes to heart attack first aid. Let's clear up a few common myths. Cough CPR. As mentioned earlier, this is not a legitimate or proven way to survive a heart attack. Instead, focus on staying calm and calling for help. Drinking water or waiting for relief. Drinking water or lying down to wait it out won't help and only wastes valuable time. Always contact emergency services immediately. Aspirin use. Aspirin can help thin the blood and is sometimes recommended during a suspected heart attack. However, only take aspirin if you are not allergic, and do so under guidance from emergency responders or medical personnel. While preparing for emergencies is critical, preventing heart attacks altogether is even better. Here are some simple, actionable steps to take care of your heart. Focus on a balanced diet rich in fruits, vegetables, whole grains, and lean proteins. Reduce saturated fats, sodium, and added sugars to prevent artery blockages. Stay active with exercises like walking, swimming, or yoga. Consistent cardio workouts strengthen your heart and improve circulation. Keep track of your blood pressure, cholesterol, and blood sugar levels. Consult with your doctor about medications or lifestyle changes if these numbers are outside the healthy range. Preparing yourself for a heart attack is essential, but sharing this life-saving information with others can amplify its impact. Encourage your friends, family, and coworkers to watch this video or learn key first aid tips for heart emergencies. Awareness within your community can increase survival rates and foster a culture of readiness. By spreading this knowledge, you're not just protecting yourself, you're empowering the people you care about most. Facing a heart attack alone can be intimidating, but you don't have to feel powerless. By recognizing the symptoms, acting quickly, and taking proactive steps to prepare, you can take control of even the scariest situations. Remember, the best response is an informed one. Stay calm, call for help, and follow the guidelines outlined in this video. Now that you're equipped with these life-saving tips, it's time to take action. Share this information with your loved ones. Adopt heart-healthy habits today. Taking these steps, even before an emergency strikes, can make all the difference. Thank you for watching, and remember, being prepared can save your life.